Welcome to another session. Looking forward to this one, where Fahim Ahmed, who also happens to be my brother, will be talking about opportunities in aesthetics, specifically for the community pharmacy market.
Thank you, Asim. Looking forward to it, folks. We've got exactly 3 minutes for this, so get yourselves ready. I'm just going to sort myself out, and we'll be with you in exactly 3 minutes. So looking forward to this, and thank you for joining. Let's see this. Thank you.
So guys, one of the reasons we're doing this today is we know what's happening with, for example, the job market and people coming off the furlough schemes. But the truth is, all industries have been affected, will be affected. Again, we're going to point out particularly pharmacy today.
Hello, just give me a second. I'm just tidying this up.
And the thing with pharmacy, one of the reports we've had in the Chemist and druggist is about 70%.
Can one of you folks just make sure that you can hear me?
Will have a deficit by 2024. So how do we move away from conventional models? So this is the topic, and Fahim's going to be presenting a live example today. So I'll leave it forward, and I hope you enjoy the talk.
Folks, we are just about to start, inshallah, in 2 minutes' time. Can you just confirm that you can see me? Can someone write it on the chat that you can see the slides, you can see me? Then we're going to be good to go. You know, they say men can't multitask, but we've got two things happening here today. We've got YouTube Live, we've got Zoom, and we've got LinkedIn Live. So, folks, I'm not ignoring you guys. I'm here, but I'm focusing on that camera there. So somebody can write it on the chat. My brother will be looking after your comments. We'll be looking after every single question that you have, because we're going to go through everything that you need to do. So I'm just going to get Wasim to just double check that. Wasim, can you check that they're going to chat right on the chat that they can see? And we are literally about to start in exactly 1 minute time. Let's just put on the chat if you guys can, folks can see. I can hear you and see the slide. Brilliant. Asil, thank you very much for that. Okay, brilliant. Perfect. Okay, absolutely great. Right, Bismillah ar-Rahman ar-Rahim. I'm going to start with the name of God first. And for those of you who don't know me, welcome. My name is Fahim. I'm a pharmacist, prescriber, contractor, founder of Medline. And boy, I am so excited, seriously, to be here today, because it is a Friday evening and you folks are here today with me, and we are going to be on a special journey together where we're going to be discussing exactly how you can benefit in aesthetics, the things that you don't want to do and the things that you want to do. So we're going to be going through all of that today. So the first thing that I want to say is set some ground rules for this webinar itself. And that is my most important rule is that you folks listen to what I have to say. You don't have to agree with it. But if there's anything here that you can relate to or that makes sense to you or you like, then use it. That is all. That is all I'd like you to do today. You can put your questions on the chat by all means. I intend to answer these questions at the end of the presentation, and that is going to be inshallah around 8:15 to 8:20, and then we have a Q&A. So please keep writing your questions on there. It's going to be great. We've also got LinkedIn Live here as well happening, so as you can see, I'm managing 2 or 3 things, which is great. I'm just going to ask Wasim to slightly turn my screen around so I can just have a look at my slides. Wasim, that'll be great. Thank you. So I've got my lovely brother here who is happily assisting me, which is great. And he's not really sorting my screen out like this. There we go. That's better. I can see it now. Okay. So what's the plan today? The plan is very straightforward. It's to show you folks how you guys in 6 months are going to do aesthetics, well, the way that I feel is going to be the most beneficial to you as clinicians who have not done this or don't have much experience in this. And I'm saying it over a 6-month period. Over a 6-month period, you folks are going to practice evidence-based aesthetics, evidence-based medicine, and you folks are going to practice this medicine that is positive medicine. And I'll be discussing that in a moment with you folks. So going into this now, what are the webinar outcomes? Firstly, I want to make sure at the end of this, you folks are comfortable with aesthetics. You don't have these questions, shall I do level 7? Shall I not do level 7? What is level 7? What is a certificate? How much time do I have to spend on aesthetics? How much does it cost? Is there a business opportunity? What are the pitfalls? Why should I get into aesthetics? I'm worried about all the competition out there. I don't know where to start. Everything I'm going to go through today. So sit down, enjoy it. That's the plan. We're going to be going through all of that. In addition to that, business opportunities, how to benefit financially, and also for you folks to really enjoy what you do. You know, yesterday I had an interesting conversation by one of my colleagues on LinkedIn. And she politely asked me that, how do you get up at 2 o'clock in the morning, 3 o'clock in the morning? What drives you? What drives you to do this and manage your business and everything you do? How do you do it? And the answer to that I said to her, is because I enjoy what I do. I'm happy to be here today, 7:30 to 8:30, after working as a pharmacist, after running my clinic, and go through this because I love what I do. I love to teach. I love the clinic that I do. I'm thankful for God for giving me this opportunity. So that is important. So write that down. You've got to do what you enjoy. It is not just about making money. You've got to enjoy what you do, because if you enjoy it, you'll find solutions. So firstly, the first 15 minutes. The first 15 minutes, I want to give you my reasons as to how and why I got into aesthetics in the first place. What got me into aesthetics? Then after that, we're going to look at the difficulties I had. We're then going to go look into how I can support you from start to finish. And then I'm going to make an offer that is irresistible. Every single one of you today is going to get that offer for 24 hours. That's going to be irresistible. And inshallah, I look forward to working with you and growing your practice, because I want to help you achieve your goals. And inshallah, with the will of God, we can grow this pharmacy profession and take it to the next level where we want to be. Not just pharmacists, all clinicians, doctors, dentists, nurses. I think all of us should be working at higher levels. We are all here for one reason, that is to look after and benefit patients. That is clear. So we're all one team. So I qualified as a pharmacist in 2010, went and did my pre-urgent boots in 2011, I believe. And then it was in 2012 when I was very fortunate to have this opportunity to mentor my brother Wasim and Tawfiq, owned a pharmacy at the time. And I was very fortunate to do that, because mentoring and being able to shadow someone who's already doing it saves you time, saves you energy, but also you can get to your destination faster. And I was lucky to do that. So I spent time learning how to run and manage a business. Alhamdulillah, it was a great experience. It was a pharmacy. And I said, look, I'll get your pharmacy to 10,000 items. It was doing about 5. Teach me how to run a business. And he taught me everything to know the knowledge that he had. And I wanted to learn. And we did that. 2012, I went on to set up the pharmacy that we have in Bicester, again with the help of my brothers and family, and it was alhamdulillah a wonderful experience. However, for those of you who have been in this industry will know that we had funding cuts. Around 2014 was a band of funding cuts that came. So I'm going to cut the story short and get to the point that we had a band of funding cuts. And interestingly enough, Wasim actually mentioned today to me that there's been an article in the Chemist Druggist, and the Chemist and Druggist article actually spoke about how 74% of pharmacies are going to be deficient by 2024. Is that right, Wasim? Right. 74% of pharmacy folks by 2024, that's what they're predicting, are going to be deficient. Now, if it's anything like the prediction of the weather, I'm not too sure if that's what's going to happen, but there's already talks about this. And any of you that own a pharmacy business, or a contractor, or are close to the contractor, will know that profit levels have absolutely dropped, and it's getting tighter and tighter. So I then had to think that, what are we going to do? And we had a roundtable discussion, and it was actually my brothers who suggested, why don't you go and do aesthetics? There's a huge market for it. Look at the prices, and I'm being straight up with you. Look at the prices, £300 for a Botox, £400 for lip filler. This is going to be what's going to save everything. This is what we have to do. You've got to do your aesthetics. And didn't know any better, didn't know what we were getting into, how it was going to work, didn't really understand about the fact that you have to be a prescriber first. It makes life a tad easier, didn't understand the concept behind how that all worked. And so we did get into that. And the thing is, right, we always knew that there's a market in the private healthcare. The private healthcare market is huge. And initially, my ideas were that I wanted to set up a minor illness clinic. My ideas initially were that I want to set up a holistic clinic where patients with, cough, cold, ears, nose, throat, wanting blood testing, wanting dermatology, the whole works could be available in one center. Why? Because the NHS is saying there's a shortage of doctors. The NHS is saying there's a shortage of nurses. So if you can solve that problem, there's an opportunity there, right? So that's what we decided to do, that we want to set up this clinic. But like everything, you have a plan, but things don't always go to your plan. Okay, there's always stuff that happens around you that doesn't go to plan. So you have to realize that. And so I did try to do the minor illness setup in 2015-16, couldn't happen because I didn't even have a clue on the level of complexity involved in history taking, physical examination, making sure you know how to document properly, making sure you know about clinical governance and continuity of care, and making sure that you can safely diagnose. I mean, you could have a patient who has a sore throat, and it could be from infectious monoclonal all the way to a peritonsillar abscess. It could be anything. And I never really underestimated, hats off to doctors and nurses at how complex this is. Not difficult. I don't like to say difficult, how complex it is. So I went into aesthetics, and there's an article here that I talked about, which is called Now or Never, Shaping Pharmacy for the Future, written in 2015-16, I believe. And it just said that pharmacists are going to have funding cuts. Pharmacists need to be aware of the fact that there's other professions out there like physician associates, nursing associates, paramedics who are upskilling you to upskill. It spoke about pharmacists developing private services. Everything is there. So you folks need to read that if you haven't read that. It's called Now or Never, Shaping Pharmacy for the Future, written by the RPS, 2015-16, wonderful article. But these were my reasons to develop my skills. First of all, I said, I do not feel that a pharmacist can just be limited to dispensing. I always felt that there's an opportunity for pharmacists to be involved in the wider healthcare profession. I didn't feel comfortable that for 4 years of studying, I'm getting up every single day and we're just dispensing when that could be done and managed more efficiently than a pharmacist can. I wanted to use these clinical skills, and the contract has never been there. It's changing now, has never actually been there to actually match the needs that we have in terms of clinical. So I had to do something privately. I wanted to in-sync my vision of the NHS. I briefly mentioned that the NHS has a shortage of doctors and nurses. 95% of people can get to a pharmacy by foot, folks. 95% of people in England can get to a pharmacy by foot. You are accessible. It's mind-blowing how accessible you are. In addition to that, you're the only healthcare professional that does not need an appointment. You can't see a doctor, you can't see a dentist, you can't see a nurse, you can't see a paramedic, you can't see an engineer without an appointment. But a pharmacist is available. It made sense to me that we're one of the third largest workforces in the UK in terms of the NHS or healthcare. Why not utilize this? But first, you have to do it and do it yourself first before you can start to, broaden this out. And I'm really excited how I've had these wonderful comments by students and colleagues who are saying to me that you've started to really change this concept because clinical skills and it's all happening of all this setup. So, and I wanted to make money. There's no harm in that, because ultimately, if you're financially strong, you can help people, you can achieve your dreams. You need to be financially strong. In actual fact, I think every single one of us should be financially strong, and we wouldn't have half the problems that we have in the world. Poverty, suffering. If we all were financially strong, we wouldn't have these problems. A hungry man is a dangerous man. Remember that. A hungry man is a dangerous man. So I wanted to make money, and you should be thinking the same concept. There's nothing wrong in that. But I wanted to help people in that process. So I thought, okay, I did my non-medical prescribing. I struggled with that. So I went to aesthetics. I'll be very honest with you. I initially struggled with my prescribing, setting up my clinic. I wasn't prepared for the complexities around it. I didn't have that support network. So I went into aesthetics. Now, again, just quickly about numbers, 1% of the population suffer with otitis externa every single year. That is 660,000 people every year suffer with otitis externa. I thought if I even got 4 patients a week, that's an extra £4,800 of turnover. That's how I saw it. So I thought that's one condition. Imagine I had aesthetics. Imagine I had a whole host of minor illnesses. Wow. And that's what's happened today. Our clinic that we're here now is turning over around £20,000 a month. What we're here today with the will of God. So, that's without including aesthetics. So my journey led me to becoming Pharmacist of the Year 2019. Alhamdulillah, I'm a judge this year, and I'm voted as one of the finalists for the 2020 awards for the Chemist and druggist. So I've had a great year. I've had wonderful support, wonderful colleagues. So that kind of led me there. Once I kind of got the cat out of the bag, once I kind of really understood how to do this. Again, some more information about Amy's Pharmacy that were in the papers, but this is why I struggled. Let's get into this. First of all, lack of support. The reason I struggled in aesthetics because I did not have support. I did not have anyone to tell me that this is what you need to do in aesthetics. All I knew was that Botox, one injection or 3 sites is £350, and aesthetics, lip fillers, you're so much. Imagine if I got 10 clients a day, okay? And yeah, you can say I was naive. You can say I was naive. You can say I was ignorant, but that's the market that there was. There wasn't much information out there, folks. We're looking about 3-4 years ago. Discouragement from others. And I had all sorts of professionals saying to me, you're a pharmacist, you can't do aesthetics, you don't know about anatomy, you know about physiology, it's not safe, you're going to cause a vascular occlusion, you don't have those clinical skills. And more important than discouragement from others was discouragement from yourself. Let me repeat that again. Discouragement from others was not as much as what was discouragement from myself. How many times have you folks not gone on to do something you should have done because you've talked yourself down? Reflect on this. Ask yourself this. You have to believe in yourself. You have to trust in yourself. You have to believe in your skill. If you don't believe in your skill, you don't have the confidence, you don't have the underpinning knowledge, you're going to struggle, because that's the way things are in this life. You ask the question and the first thing someone says, don't open a pharmacy, you'll make no money in it, but yet you're doing it yourself. Or don't get into aesthetics, there's no money in it, but you've got aesthetic clinics everywhere. So that's the kind of thing that I faced. Fear of the unknown. I didn't know what I was getting myself into. I didn't have a clue. I didn't have anybody to mentor. I didn't know what to do. Vascular occlusions. What if I occluded a vessel? What if I hurt a nerve? I've not been taught this inside out. What would happen? What about litigation? I'd have no leg to stand on. Lack of structure. There wasn't courses out there that I felt were really for non-medical prescribers or non-doctors. It was taught by doctors, it was taught by dentists, and which is great, alhamdulillah. But I had my own learning needs. I didn't study med school. I'm a pharmacist. My clinical skills are not like nurses, not like doctors at the time. So my needs were different, but I was put with everybody else, and it was just all sorts. You can imagine that. Finances. Any level 7 course, if any of you folks know, for level 7 certificate, £9,000, £10,000. A one-day course I realized wasn't enough. Courses weren't designed for pharmacists and the needs. That's what I felt. That was my own opinion. I had some wrong advice given to me, which I won't get into too much, but I had some misinformation being told to me about certain things that you have to do. That this is the way you have to do it. You have to get this certificate. You have to do this. Otherwise, you can't do this. Otherwise, you can't do that. And so I went with the flow. E-learning. I like e-learning. I think e-learning is great. But I like to be taught. I don't just want to be sat in front of a computer screen and go through generic content, because I've got no one to interact with. And I think e-learning is great, folks. For all of you lot, it's great, folks. But I want more. I wanted more than that. I didn't just want to be taught e-learning and then just go do a couple of classes. Scared of injecting. Oh, wow. I'm just going to show you this. Let alone, the only thing I was confident with at the time was doing travel. And holding a needle the right way is a skill. Holding the needle and knowing injection anatomy, we're going to get into that. What I mean by injection anatomy is a skill. And the reality was I didn't know. I was taught differently, and all of a sudden you're being told to hold a needle in a specific way, and words like has to be injected in the right plane. You're talking about fascia, you're talking about all these different tissues that lie under the skin, and I hadn't a clue of any of this, and it was all mind-blowing. You attended a foundation day, and you sat there thinking, wow, words like, what's the maxillary, what's the venous sinus? What is the facial nerve? What is the maxillary nerve? What's the trigeminal nerve? Words like, you've got to make sure that you go at the right plane. You've got to make sure it's on the periosteum. What did that all mean? I didn't have a clue. I wasn't taught that. Not believing in yourself. I've already mentioned that. Not being trained on history and examination. We used to do WAM. But when you actually go on to do clinical skills, you realize that WAM, or history taking physical examination, is like WAM on steroids. So it's a different ballgame. I didn't know. Just imagine you've got a patient. Let me put this into perspective. You've got a patient, right? And you're doing an aesthetics treatment. And you say to them, there's a lot of aging happening here. I can see that the loss of tissue in there's a lot of fascia that's being reduced. Whatever you want to say. And that patient is sat there and you have totally destroyed their confidence even more than what it already is, because you're too much in the medical mindset and you're not realizing that it is a business at the end of the day. So I didn't know that. So when I started, it was just medical, that actually, yes, you're right. You've got one wonky eye. You've got a ptosis, so you've got these things, that thing's wrong with you, that's wrong with you, that's wrong with you. I never used to comment on what is good with you to make the patient feel relaxed. I wasn't taught that. I didn't know that. Too many courses. Level 7. Certificates. I had to do level 7. I spent around £50,000. I had to do level 7. Level 7 was the one. The diplomas, foundation days, I just thought level 7 is going to be it. Everyone's doing level 7. And then I realized something else. So we get into that. Some people might say that it can't be done in 6 months. I did do it in less than 6 months. And then I didn't have protocols in place. When I first started, we were used to algorithms, weren't we? PGDs. It tells you exactly what you have to do. It tells you how much you inject. It tells you exactly what volume you need. With Botox, it was a case of you have to assess the patient. Depends on what they need. It's like when I do a lot of, when you do these dental blocks, or when you're giving someone, anesthesia. It's not just, you do have a set dose, but you have to be able to tailor that. But initially, I needed a set dose. I need to know that these are the units, and with fillers, it wasn't that made clear to me. It was like, well, look at the lips, look at how they're aligned. And it was just way too much, way too much for me. And I wasted probably a year doing it. I actually, between you and I spent 1 year actually doing, I spent 1 year studying cadaveric dissection. I used to go to St. Andrews, and I used to do the human dissection because I wanted to do it. I had done all the training. I just didn't feel comfortable. So I just thought, okay, let me go to human dissection. Let me look what's under the skin, because no one else had told me that, because the books only give you an average depiction. And I want you folks to go after this and have a look at the different variations in the facial nerve. Have a look at the different variation in the supra-inferior labial nerve. Have a look at that. You'll find out that a book will tell you that it crosses here, goes superior, then inferior, but there's variations. Every one of you could have a different path it takes. It's not that straightforward. I didn't understand all this. And scared. Vascular occlusions, you're going to hit a nerve. And it was all negative medicine, in my opinion. So I'm going to tell you now exactly how you're going to do this. I'm going to give you the standard price that we set. And then I'm going to give you at the end the price that we are setting for 24 hours today. I'm going to tell you exactly step by step what you have to do. And the prices, it's just going to blow you away, inshallah, when we go through that. But an aesthetics clinic, I want you to write this down. An aesthetics clinic is more than just aesthetics. If you want to do well in this and you want to benefit financially, it's more than just aesthetics. You must take a holistic approach. And I'm going to be talking to you briefly about dermatology as well. That is what's going to separate you from everyone else. It's really important for you folks to remember that you've got to combine dermatology or cosmetic dermatology with aesthetics. So we're talking about those eczemas, we're talking about those rosaceas, we're talking about this acne, we're talking about these chemical peels, we're talking about all these things that will separate you from everybody else. Because you as a pharmacist, I like to sell the jack of all trades, and you can develop your skills to become competent in a particular area. So you have a huge advantage. You're already an expert in medicines. So if we could teach you to diagnose basically diagnose, you'd know what to treat. So keep that in mind, dermatology. I'll go through that in a second. So first of all, Health Education England. Let me get this right. Or let me clarify this. 2014-15, there was guidance by Health Education England. And the reason why the guidance was actually released was because there was no, and there is still no, regulation of aesthetics. Anybody could do aesthetics. You could be a beautician. You could be, you could be doing at the back of a caravan. You could inject Botox because it wasn't technically a medical grade treatment. Anybody could do it. So Health Education England then set some standards. They said, okay, we want folks to be trained at level 7. Level 7 is essentially a learning that's basically a higher level. So when you come out of pharmacy and you become a postgraduate, then the learning that you should be undertaking is at level 7. And that is where you are working autonomously, you're gathering information, just like when you did your dissertation. essentially preparing you for that level, where you're not being spoon-fed like we were at school, right? That was level 7. And what they stipulated was that we're not able to regulate this at the moment. And there's various reasons for this, because you have to remember that a lot of these big pharma companies, there's a lot of stuff that goes behind the scenes. That's all I want to say about this. And they supply to beauticians, they supply to all sorts. So at the end of the day, it was tricky. And teaching level 7 for a student who's not gone to university is not possible. But essentially, they stipulated that pharmacists, nurses, and doctors should be taught at level 7. And that's the standard that we're going to set. Not a regulation. It is not a legal requirement that you have to have a level 7 certificate, but you should be taught at level 7. You should cover all these. This information should be in a course. That's the point. And you can have a look at it, it's still there. This was in 2015. And the plan was with the JCCP was to eventually regulate aesthetics. The plan was like the GPHC, like the CQC. The JCCP were the ones who were supposed to regulate aesthetics. But there was a problem there. The problem was that if you have medical clinicians, they used to say, wait a second, a pharmacist, I'm already regulated by the GPHC. Why do I need to be regulated by the JCCP? The JCCP also had to represent beauticians. They're not medically trained. I'm not saying they're not competent. That's nothing to do with it, but they're not medically trained. So why would I want to associate with them? And it all got really messy. It all got messy, and eventually nothing happened. No regulation came into place, and since 2015, that's just been sat there 5 years from now. And that's not going to change. In my opinion, that boat has gone. Okay, there's too much behind the scenes that happens. I doubt it very much that's going to change. Yes, we all want to practice evidence-based medicine. Yes, they are fighting to get this regulated, have a qualification. But with the coronavirus, I can't see why they would want to increase the rate of unemployment now by stipulating something like this and saying that everybody aesthetic stop. Either you have a level 7 certificate or you can't practice anymore. Can't see that really happening right now. So that's a bit of backdrop information for you folks to have a read of. Have a look at it, see what you think. Essentially, that is the modules that have to be covered for you to be taught at level 7. That's the kind of rationale for it. I hope that answers your question about, do I need to do level 7 certificate and pay £10,000? I hope that makes sense. However, that does not say about gaining competence. I've not mentioned anything about you becoming competent in this skill. Now, for you folks, I have set these domains. These domains have been set for you folks, exactly a pathway that you folks are going to follow to become competent in aesthetics. Domain number 1 talks about the clinical and the consultation skills. It speaks about making sure that you've got the right consultation skills and you can properly undertake a consultation. Domain number 2 talks about clinical governance, information governance, talks about making sure that you've got that continuity of care. Domain number 3 talks about the prescribing clinician in the wider profession, having, liaising with doctors, liaising with nurses. Domain number 4 talks about evidence-based practice. And folks, we have to practice everything evidence-based. Very, very important. You have to practice evidence-based. You have to make sure that you have something for you to be able to back up and for you to be able to practice safely. Domain number 5 talks about the science. Domain number 5 talks about underpinning to make sure that you can take you understand your anatomy, you understand your physiology, because this is where I struggled. I used to buy and just sit and practice with these mannequins. I used to get these mannequins, and my brother used to laugh at me, what are you doing? And I'm just like, I used to practice the injection depth. And he's like, what does that mean? I said, I'm just practicing my technique. I wasn't taught it the way that we need to be taught it, in my opinion, or I felt that anyway. So what I'm trying to say is, for you to develop your aesthetic medicine, it is not just about learning how to inject. It's wider than that. Your consultation skills, your documentation, your paperwork, your business skills. Ultimately, you've got to keep the lights on. How are you going to make money out of this? There's no use you having a wonderful skill, but nobody knows about it. You won't make money in that. You will not make money in that. You can have, if you've got the greatest skill, but you can't sell it and you can't market it, no one's interested. You just spent all that money, can't be done. We're talking about making sure you're safe. So if you have an inspection or somebody questions you, or another clinician goes, why are you doing this? You feel comfortable to answer them, yes, this is XYZ why I'm doing this. This is how I can do this. These are the skill set that I have. Not that you have to defend yourself or you have to show why you have to, but you'll feel comfortable in your skin. And this comes by making sure that we look at these domains. So you might say, Fahim, that's great. I like this. But it's still a bit confusing. What are we actually going to learn in this course? What are you offering us? It's just kind of a bit gobbledy. I don't get this. Well, if I have your permission, and I hope I have your permission, I would like to now go into exactly how we're going to go through this. And I'm going to break it down. So I'm going to tell you exactly the steps that you have to follow. I'm going to tell you our baseline cost. As you know, this is taken from my mastery program. And that's the baseline cost there. That is not the cost that you're going to pay for the course. That is the cost that I normally set it at. So we've got that there. The first thing is your anatomy and physiology. There is no way that you are going to get a needle and inject it in somebody's face and not understand what lies under the skin. That is not safe. That is just not going to happen. There is no way that you can inject somebody or do any sort of medical treatment and not understand how the human body works. And let me give you an example of, this example. If you don't know what normal is, how would you know what abnormal is? If you don't know what the normal human body or the face looks like, how it ages, how the tissue changes, what proportions it should be, then you're never going to know what happens when it's abnormal. So your anatomy, that is knowing your landmarks, knowing exactly where you inject the product. How do you know that you're in the right, when we say the word depth, how do you know that you're in the right place? How do you know that you've not injected too high up? Because if you inject these products in different areas of the face, okay, for those of you who don't understand, but the skin has layers, right? You've got the epidermis, you've got the dermis, you've got the subcutaneous tissue, you've got then, you've got the muscular layer, and these products have to be injected at the right level, at the right tissue. If you inject too high up or too high up in the dermis, you might get the Tyndall effect where the lips become blue. If you inject in the wrong plane, you might compress a nerve or you might compress an artery and cause an occlusion. So you need to know that where am I injecting, and more importantly, injection anatomy. Injection anatomy. And you're thinking, Fahim, what did you say? Let me repeat that again, injection anatomy. Because it is not your hand that is actually going in the skin. It's this here. This Botox that you'll be injecting is going into the site with this needle. So what's more important? Is it more important you knowing where your hand is resting, or more important you knowing more likely where the needle is resting? Put it on the answer. I'll check that answer later, but I'm sure you've got this. You tell me, what is more important? Knowing that my hand is resting on the mandible, or knowing that my hand is at the right place, but the needle is at the right depth where the product will be injected? So that is, and we normally charge £5,000 for that course. That's part of our mastery program, but I'll be going through how you're going to get this part of this course. So we move on to the next step. That's your anatomy and physiology. That's your theory. History taking. You need to know how to take a history. You need to know how to take a history properly. And yesterday I was teaching one of my colleagues on my mastery program, and it was about this patient who actually had who actually traveled abroad and had pain in the left iliac fossa, that's the left lower quadrant, and she had constipation, and it was tender. And he's learning, he's practicing, but didn't take a thorough history. And in actual fact, there was a risk that this patient might develop diverticulitis. Okay, because diverticulitis, for those of you who don't know what that is essentially inflammation and infection that can happen in the large intestine, where you develop these pouches where feces and bacteria can stay and it becomes infected. And one of the common features is that you can have a fever, you can have lower left, commonly left lower quadrant pain, and you can have change in bowel motion, constipation, diarrhea. And he didn't take a history. He said, okay, let's just treat the constipation. And you can imagine what could have happened. He just said, oh, let me give you some lecture to constipation. So it's really, really important for you to take a thorough history. You've got a patient who has a history of herpes simplex and develops blisters. You do an aesthetics treatment, you miss that out. They develop blisters and they get herpes. They're going to come back to you and going to say, look what you caused. Look what you've done. So that's important, that your history, your physical examination, you being able to take a proper history and making your patient feel comfortable is so important, because these folks are your clients. These folks are patients, but they're also your clients. So you need them to, you got to give them the wow factor, folks. You don't want to be sat there and making them feel all bad about themselves, you have, in my opinion, if not a duty, then you have a responsibility, whatever you want to say to these patients, to make them feel good about themselves. And we all should be doing that. So the consultation is important. You need to make sure that you consult properly and you document properly. If it's not written down, doesn't exist. And we're going to go through that. Again, this course is priced at £5,000, but I'll be telling you exactly the price that we're going to be doing at today. In addition, the physical examination. Again, it's very, very important for you to undertake an examination for a patient, and it's being able to understand how you relate to your findings. There's one thing you're doing a physical examination, you can teach a 5-year-old how to examine, but what do you do with that information? How do you make sure, for example, you have a patient, right? This patient comes to you and has a fever. You take the pulse. So the patient has a fever of 39.2. You take the pulse, and this patient's pulse is 60. Now, something's not right there, because if your temperature is up, sodium channels are going to open. Your heart rate should increase. It's the normal physiological response. But in this case, it hasn't happened. Could this person be going through sepsis, or maybe this person's on a beta blocker? So again, your examination is important, and you must understand this. So again, we go through this because when you're doing any medical treatment, it's important to know how to do an examination and properly relate to your findings, and not just tick box exercises. DMP, for those of you who are not pharmacists, prescribers, again, we can sort that out for you. If you're struggling to find someone to be your mentor, we can do that. It's something that I'd love to do, but I'd love to help you with this. But as you know, a lot of stuff, I'm always busy with doing something, so it's not something that I can personally mentor you in. But absolutely, we can sort that out for you. So that is something that we can sort out for you folks as well, for those people who are not prescribers. And let me tell you something about not being a prescriber. For you folks who are pharmacists and not prescribers, it's not be all and end all, because you can go and you can get hold of individuals who will prescribe for you, and you can start to develop your practice. You develop your skills and then also jump onto a prescribing course. It's not be all or end all. Just because you're not a prescriber does not mean that you can't invest in yourself and gain the skills. However, it does mean that it's important for you to understand that you work with the right people, because as it stands, anyone who's doing consultations for aesthetics should be face-to-face, unless that's changed. As far as I'm aware, that's how it should be done. So we want to be careful with working with individuals and folks who are not doing it face-to-face. It is a bit naughty. Aesthetics, this is it. Have a look at that picture in the right-hand side. Have a look at that picture. And if any of you is told that you are not violating a vessel when you inject, that is absolutely rubbish. The human body is way too complex for that, folks. Look at the vessels. Do you really think that you're going to miss those vessels when you're going to inject somebody in the face? Look at those vessels. It's impossible. But this is what you need to do. You need to know your anatomy and physiology and your landmarks. You have to know exactly how to inject, where to inject, and how to make sure that you're safe. Okay? You do not have the luxury to get a scalpel and start to open up the layers of the skin and say, aha, that's the facial nerve, we're not going to inject there. There's no art to that. Well, there is art to actually dissecting. There is an art to that, but there is no art to you getting a patient and saying, okay, let me go get this special device that tells me every single, not that you shouldn't use technology, nerve or vessel there, will make sure you're safe. You don't have time for that. So you have to go with what we call landmarks to make sure that you're injecting in the right place. And some of you might be like, what do you mean by landmark? For example, when you measure the pulse, how do you know that you measure the pulse? It's the radial pulse that you measure. How do you know it's to the outer side, or to the, not the medial, but the lateral side? How do you know that? Because you understand landmarks, okay? Injection technique. You need to know exactly what depth you have to inject at. You need to know where to put the product. Very, very important to make sure that you're doing that. It's also important to make sure that you're dealing with complications. This is very, very, very important to make sure that if something happens, or rather when something happens, you don't panic. You don't panic. Because one of the biggest, scariest things for me was that when a occlusion happened, or when you have a patient who has possibly, where things do happen, how do you react to that? And I believe that we should practice evidence-based medicine, of course, and positive medicine. not on the back foot send positive, negative medicine. So that's really, really important to make sure that you're taught that, so you're safe. And anaphylaxis, proper airway management, knowing when to inject adrenaline, knowing when to use chlorphenamine, knowing when to use hydrocortisone. All pharmacists should be properly trained on an anaphylaxis. If you have a patient, you know exactly what to inject, where to inject, you can deal with that comfortably. Now that is important in my opinion. Those are so important. Not just complications. You've got a person who's now having an anaphylactic shock. What do you do with that? It's not that straightforward of injecting EpiPen. You need to be able to manage that. Okay, I know what to use, when to administer adrenaline. I know how to use hydrocortisone. I know when to use chlorphenamine. I know what to do. You've been taught it properly. Proper airway management. Health and well-being in a holistic approach. We need to take a holistic approach to medicine. And the reason I say that, because there's a lot of competition out there, folks. You will not be the only person doing aesthetics, and you will not be the last person doing aesthetics, but you have one advantage, and that is that you're a pharmacist and you understand medicines better than any other profession, because that's what you're trained to do. Not that anybody else can't develop their skills in pharmacology. Yes, you can, just like you can develop your skills in medicine. Of course you can, but a holistic approach. And what I mean by that is dermatology. Dermatology is huge. Imagine you had a clinic set up, right, where you do aesthetics and you do dermatology. So you have a patient who can walk in with acne, you can treat it. You can treat it with chemical peels. You understand how you get acne and you can manage that properly. You can treat it with benzoyl peroxide and you know how to use retinol, you know all that. Brilliant. Imagine you had a patient with eczema. How many patients do you in the pharmacy come with eczema? Imagine you could treat that and you can set up a clinic and do that properly. Rosacea, another real big one. Imagine you can offer all these treatments, rejuvenating the skin, making sure it's glowing, making sure it's being looked after. You've got to also take approach to dermatology in your clinics. And you might then go down the route of adding phlebotomy in there. Some of you might even go down the route of using the vitamin injections. Again, that's a conversation for later on. It's not something we're discussing now, but I'm saying take a holistic approach, separate yourself from everyone else. You don't just want to do aesthetics, you want to do both, dermatology and aesthetics, and grow your practice. Clinical governance, consent forms, SOPs, aftercare leaflets, algorithms. There's no harm in when you first start off to have a tick box sheet that you use to gain the confidence that, I've done this properly, I've injected the right units, I'll start off with this many units. When I first did my Botox, I didn't appreciate that actually not everybody needs the standard doses. Not everyone needs the standard doses. Some people need higher, some people need less. And do you think it's better to inject more or inject less and then top it up? You can write it on the chat. You should be chatting amongst yourselves as well. You should be networking today as well. It's a huge opportunity. What do you think is better? And my brother is busy on his phone, so I will quickly go through this and have a look at your questions. And you folks, absolutely. You want to make sure that it's probably better to inject less and then you can top it up, because Botox isn't reversible. And if anyone tells you that you're going to get it right every single time, that's impossible. The human body is way too diverse for that, and we've got to give it more respect. It is impossible for anyone to say that I can look at a patient right now and I can say, you need 4 units, you need 20 units. With experience, you'll become better at it. I absolutely agree with you. But you will not 100% be able to nail it every time. The human body is way too complex. How do you know what the liver function is? You don't have access to that. How do you know what sort of diet they have? How do you know this person goes and does Botox and then goes straight away into those tanning studios? What do you think is going to happen to the layers of the skin? So it's always better to, and again, you will develop your practice to inject slightly less and then top it up, and tell your patients that we're going to start this regime for you. Once we've got your regime correct, these are exactly the top-ups that we're going to be using. So initially you might say, I'm going to inject 2 units here, 6 units, the normal standard doses, and then we can top it up. That's my point, is a baseline. You don't have to agree to that. You don't have to agree to a baseline. You could go with slightly higher, but then it's not reversible. Especially fillers, folks. If you inject too much filler, you are putting yourself at risk of these vascular complications, and you are putting yourself at risk of damaging these nerves. So it's important to make sure that you understand how much you need, and we provide you with all that. It's important for you to know the equipment. Who do you go with? There's Juvederm, Allergan, there's Bolotero, there's a Thiocell, there's loads of different products out there now, and they all want your business. Who do you go with? What about insurance? Who do you get insured with? How do you do the insurance? Which company do you go through with? It's not that straightforward of just getting insurance. You need to understand who you need to go with, because if something goes wrong, are you covered? They'll all happily sign. It's like with prescribing, right? You'll get insured, but it's only when a mistake happens, they'll say, where's your documentation? Where's your consent forms? What training have you had? What did you write down? Where's the evidence for it? And if you've got nothing to show them, sorry, Fahim, that's unsafe. We're not insuring you for that. You were not competent, is what they will say. So now I'm going to tell you exactly, and also setting up a clinic. Now this is great, right? Entrepreneurship. I love entrepreneurship. I'm a great fan of it, and it's something I like to have in all my courses, is to teach you how to set these clinics up, from SOPs to consent forms to record keeping to workflow management, insurance, scope of practice, auditing your practice. So important. Because when was the last time we as pharmacists were actually shadowed by another pharmacist and audited our practice? Hand on heart. When did you ask yourself when you last went to you were last audited by your peers? When you said, okay, have a look, am I practicing good practice? Am I doing the best evidence base out there? Because when you start working at advanced levels, whether it's treatments, whether it's prescribing, whether it's giving advice, it's important to make sure that everything you do is peer reviewed and it's evidence based. And auditing your practice is important as a clinician. And we go through that to make sure that it's being audited properly. CPD, very important. Working with workers, surgeons, working with prescribers, we go through all that. Again, normally your price is at £5,000, but I'm going to tell you exactly what we're going to be doing for you folks today. So in addition to all this, dermatology, which I'm a great fan of, and we will also be teaching you part of this course, dermatology. That includes you understanding the layers of the skin. That includes you being able to properly diagnose skin conditions and not just feel that I'm going to throw everything under the sink at it. Anybody comes with a skin condition, give them a steroid, give them antibiotic. You don't have to do that. There is a way to this, that you can do this, and I'll teach you that. You also want to be able to manage these. I put 3 conditions there, but you can develop your practice and you can do way more. But acne, eczema, rosacea, huge market for it. I feel it's important for somewhere for you to start at. So dermatology is included in this. So what are we doing then? Why MedLearn? Why us? Well, first of all, yes, we have access to e-learning. You get e-learning. It's important for you to develop your content. But in addition to that, you are taught these lectures. I love teaching. It's now 8:15. I could teach for the next whole day. I could be sat, I could be teaching you day and night. I absolutely have a passion for it, and I want to teach. I want you to spread the knowledge. And I always say that you're never too young to teach, and you're never too old to learn. Okay? So you get access to teaching. You get taught this in addition to your e-learning. You also get access to recordings of all the webinars that we do. Everything is evidence-based, peer-reviewed. The course that we're offering is at level 7, so it conforms to the health education standards. It conforms to HEE standards. You'll easily get insured as well, and it's at level 7. So it is at level 7. Everything that health education wants is in this course for you. All in line. It's CPD accredited, so you can use it with the CPD. And we are working with the GMC, and we are working with the GPHC and other universities to get further regulation and qualification for this. But as you know, at the moment, there is no regulation of aesthetics. So it's not something that is something that you have to be overly, worried about. More important is going to be to make sure that you're competent in what you do. Make sure that you're safe in what you're doing, and make sure that it's evidence-based. All the classes are interactive. You also have face-to-face classes as well. Practical demonstration of how to do this with hands-on practice. Both things are important. There's one thing you're watching, but there's also one thing you're actually doing it. In addition to that, you also have access to all the guidelines that you need, from your consent forms to your algorithms to how much dosage you need to inject. All will be given to you in a pack, so you know exactly how to work with. And everything is a blended approach of theory and practice. So you get your consent forms, you get your training, you get taught dermatology, you get taught aesthetics, you get taught how to be safe, you get all this. Everything is mapped across Health Education England, and I'm about to tell you today exactly how much this is going to cost you. And again, some beautiful feedback from my students. Any one of you that follows me on LinkedIn, knows what I get up to in my time or in my spare time. So it's a wonderful feedback, and you've already, you folks are already out there. So thank you for that, for doing that. But how much are we doing this course for? For the next 24 hours, we are selling this course for £2,995. £2,995 covers everything for the next 24 hours if you folks sign up. If you folks sign up today, it's the next 24 hours. Okay, we were going to limit it to 5 students, but we are happy for everyone to sign up to that, and it's £2,295 today to sign up for that course. All of you folks have 24 hours to sign up for that course, and that is specially out there, and that's what we're covering. And in essence, let me go through in depth what we're covering. The start date is the 16th of November. The course length is 6 to 12 months. Initially, you get access to the e-learning material that we provide you with, and it's about 100 hours worth of learning that you have to do, 100 hours worth of e-learning content on our e-learning platform. Then you get lectures on dermatology, where I will teach you dermatology, cosmetic dermatology, to make sure that you're safe and you understand how to do this. You then have observation and face-to-face observations. I would love for you folks to come down, or we can do it via remotely if you're not comfortable coming down. I'm also happy to observe and work on your clients if you've got your own clients, no problem. 10 treatments of Botox, 10 treatments of fillers observation, that is in line with the health education England standards. In addition to that, practical one-on-one training for Botox, 10 injections for Botox, 10 injections for fillers, lips, cheeks, chin, and jawline. We are covering all this, 10 injections each. We will provide you with the models. If you have your own models, I'm happy to work with you and come and visit you folks to get your training with your own models, not a problem. If it's difficult for you, you have your own models, can be done. Some FAQs, when does it start? 16th of November. How long is the course? 6 to 12 months. You could do it in less than that, but 6 months is reasonable, and you'll be injecting well before then. How much does it cost? 24 hours, £2,995. Will I get a certificate? Yes, you will get a certificate. That's level 7. So level 7 is taught at level 7, aligned with Health Education England standards, CPD accredited, and you'll get your insurance with that. Medland recognize it, CPD recognize it. Is it at level 7? Absolutely it is. How do I sign up? You visit medland.co.uk. How long is the offer? We've got it on for 24 hours starting tonight. It's live already. You folks need to sign up. Will I get support? Yes, you get access to the Facebook forums, and you get access to mentoring throughout your training. So a checklist. All training evidence-based, ticked. Injection technique, covered. Product selection is going to be covered. Depth, volume, where you inject, covered. Occlusions, covered. In-depth anaphylaxis management for you as a pharmacist, wherever, from airway management to in-depth anaphylaxis management. Undertaking a thorough history and examination. Clinical governance in place. All set up and your procedures given to you. Mentoring and support, and insurance covered as well. And I would advise you, which insurance team to go with. That is everything there. And now we are in a position to go through any questions that you have. So Wasim can actually monitor this and ask me any questions. So we'll be going through that. Any questions you have, write them down, and I'll be happy to answer them where I can for you. And thank you very much for you folks for being here. We can really appreciate it. You spent all that time. Let's have a look.
Okay, so
let's have a look what we've got.
Can you give an example of evidence-based in aesthetics?
Okay, so an example of evidence-based in aesthetics, absolutely. So the first one would be the use of something like a nerve blocking agent. When do we recommend using nerve blocking agents? When do we recommend using dental block? Okay, it's not for everybody, but it's important for you to know when to recommend it. You don't want to be injecting and start to a dental block on every single person. Evidence-based medicine also, when we're talking about aesthetics, is making sure that you're using treatments at the right depth. For example, you have a filler that's high prime that causes a lot of volumizing, and you inject it into the dermis, into the superficial layer, and it causes this person to start to have bruising and the Tyndall effect. That's not evidence-based. Why? Because they told you that injection needs to be injected at a lower depth. Why do we inject some? For example, injecting the forehead with fillers. Now there is so little tissue there. If you start to use a filler that is really gives volume, and you inject in this area here, and we have an anastomosis of loads of different vessels, you are going to cause a complication right there. You should have gone with a filler that is a lot less what we say filling or volumizing, and doesn't have that much, doesn't cause compression of the vessels. That is what I mean by evidence-based. I hope that answers your question.
Okay, so how much practical experience do you provide, and is there a separate cost?
How much practical experience do we provide? So the practical experience itself is governed within those those days. So we do 10 treatments for Botox, 10 treatments for fillers. If you have your own clients and you have your own patients within those 6 months with your own patients and your own clients, if you can organize them, I am happy to come and mentor you where possible for those patients in those treatment days. No problem for me. If you have 1,000 clients, we can do it one-on-one with 1,000 clients, no problem. But for the clients that we can organize for you, depending on the volume of students we have, that is what we offer. But if you want more clients and you feel you want more hands-on experience, we can offer that.
Okay. What do you think the job market is like once we are accredited?
Okay, so what's the job market like when you accredit? Well, with anything, okay, there's obviously a market out there that they're doing it, but you have to be business savvy. These are two different things now. You having a skill and being able to inject has nothing to do with you being able to sell a product. And that is what we teach you. But ultimately, when you set up a business, anybody knows who's been in business that when you do a business, it's very important for you to understand that there's a risk attached, but we can mitigate that risk by making sure you have a business plan in place, making sure that you have got the right marketing in place, making sure you do your setup properly. But ultimately, if you're going to do set up your own business, it's a different ball game. But if you want to set up a aesthetics clinic in pharmacies, Wasim, you tell me, if somebody was to approach you as a contractor and gave you a business plan for your consultation, would you bite their hand off, yes or no?
Absolutely. Right now, with the way the economic situation is, every space is just as important as whether it's small or large. So you want to be thinking about how you can maximize your profit with that space. And if it brings in more footfall or improves the profit margins on your bottom line, then absolutely you'd consider it, especially if someone else is offering to kind of pioneer the service for you. And it actually ties in with the whole model of collaborating together.
And less risk. Yeah. You've done the training, you've done the investment, you come to Wasim and say, Wasim, I would want to rent your space, or we'll do a profit share. He's going to bite your hand off. Yeah. This is where you've got to think of this. The job, you don't have to set your own business up. There are how many? About 8,000-9,000 pharmacies.
And again, the term business is not even physical space. Like, you partner with these pharmacies, it can work collaboratively. I don't think we should look at it as a perspective that this is going to be negative for contractors, or I think there's a big opportunity for a collaborative approach here, because you can't do everything.
Agreed. Absolutely.
Insurance, roughly, what kind of costings are you looking at?
So insurance varies. It depends on what you want to get insured on. It depends if you're doing Botox, are you doing fillers, are you going to be doing what treatments you're going to be doing. It also depends on if you're doing chemical peel. So these things can vary, but it's not overly expensive. But again, we would discuss that with you in the course itself. But it does vary depending on what treatments that you want to deliver and at what level.
Got another question here from Shaira. How does it fit in with the IP course?
How does it fit in with the IP course? So that's a good question. And I'm guessing what you're saying is, how can you do it alongside? Essentially, you could do your non-medical prescribing. The non-medical prescribing is separate to this, by the way. That £3,000 for non-medical prescribing is not included in the £2,095. That's a separate course. So I just want to clarify that. But absolutely, we could tie that in for you. If you wanted to find an IP and you wanted to become a prescribing clinician, we would separately do that for you. You could do it in aesthetics, but my advice would be to not specialize in aesthetics. I would say do your aesthetics qualification, but for your non-medical prescribing, do it something like minor illnesses, because you want to set up a holistic clinic itself. You don't want to limit yourself to aesthetics. You want to be, as a prescribing, do all things, set up a holistic approach, open your market, because not everybody wants nip fillers, but people do need treatment for their minor illnesses, and there's a market there as well.
So if you're provisionally registered as a pharmacist,
yeah,
and you want to go into aesthetics, do you think this course would be too early, or is it better to start early?
Okay, If I was given this advice 10 years ago, from the day that I qualified, I would have done everything and anything possible to educate myself. That's what I would have done. If I was to go back the hands of time, from my prescribing qualification, everything I would have done as soon as I could. If you're provisionally qualified, you're ready, you should be doing this now because you're ahead of everyone. You are thinking on the right tracks. But not at the expense of your GPHC registration, because you have to pass that exam. So you need to factor that in. I don't want you to do this aesthetics and God forbid you don't pass that exam. So you've got to manage that. But if I was in your opinion, I would be educating myself today, because the biggest commodity that we have is knowledge. Nothing else. You've got knowledge, people pay you for it. That's it.
Question for Sarwar Shah.
Sarwar. Hello, Sarwar.
It's in regards to the changing landscape in community pharmacy. I know we've talked about that already. We know that the funding-based model is not suitable. Yep. In fact, the report from the Chemist and druggist about 70% plus pharmacies in England having a deficit kind of, it supports what you're saying. So do you believe in a more service-based featuring community pharmacy, also in terms of clinics and assessments of patients? Do you feel within community pharmacy you have necessary resources to conduct diagnosing, assessment, prescribing compared to hospital or general practice?
Okay, good question. First of all, let me clarify what I see as pharmacy and service. You're already offering services. We've just been doing it free for too long. Okay. Secondly, pharmacy. You're not a pharmacy. You've got to get out of that model. If you're a pharmacy and that is all you're doing in the next 10 years, you are going to be out of business. You're a healthcare professional and you are broadening your aspects to healthcare. Anything to do with healthcare, you're going to be doing it. If that means aesthetics, if that means advice, if that means weight loss, if that means mental health, everything. You're a healthcare provider. Absolutely, you need to look at it like that. Diagnostics. We do all diagnostics. We do so much point of care testing. Is unbelievable down here, from D-dimer to troponin levels, everything we do in this clinic. So my point of view is that you're a community, you're a healthcare business, and one of the services you provide is dispensing medicines, is offering treatment for minor illnesses, is offering treatment for a wide range of conditions and point of care. Regarding appropriateness, let me make that very clear to you. Essentially, if you can't take a history properly, you can't undertake a physical examination properly, that is where you're going to get stuck. You've got access to SCR. Not every single doctor, every single clinician has access to all medical records. Ideally, we'd love that to happen. It doesn't happen everywhere. You can't just, you've got a patient in front of you, you don't have time to do everything. There is a shared risk that you and the patient take, but that's where your governance needs to be in place. That's where your history taking has to be in place. That's where you have to make sure that you're trained properly. If you're not trained properly, you are absolutely at risk. And that's where pharmacists have fallen foul. In actual fact, GP practices. I haven't got that picture up, but it was in 2019 November, pharmacists working in GP practices. It's called the killer trial. We're waiting for that result, but pharmacists, unfortunately, working GP practices have landed themselves in trouble with moving at a higher pace without the support. And you can read it, if you want the references that I can give you, that have a look at the article. It was in the Sun. It said pharmacists kill patients trying to take over GP jobs. So it's not to do with having access to. Absolutely, you need the access. Of course you do. But you've got to be able to practice safely. And just because you're in a pharmacy setting doesn't mean you can't. You already prescribe. You're already doing it.
To tell this off, then these two questions kind of come together.
Yeah.
So from Rodney and Shazad, is it recognised by some of the main insurers?
Absolutely, yeah. So the ones that I like to use, Cosmetic Insure, that's who I'm insured with. So it is recognised by them. That's who we work with. Insure Cosmetic Insure, that's who we're recognized by, that's who we work with, and that's who I would say, because you get discount. Okay, so we're looking to partnership, well, we've already partnership up with them, and you get discount with them. So I'd advise you to do them. Ultimately, you can go whatever you choose to go for your insurance, and yes, it's recognized.
Would you update for practical sessions? Difficult with COVID? Is there a final exam?
Okay, so with your practical sessions, again, the e-learning is first. Everybody will work differently. So it depends on where you are with your practical session. We start the e-learning on the 16th of July, and from there on, we work with you to organize that with you. Everyone's different. Some of you might complete that in 2 weeks and ready for the practical. Then we've got to go on to the theory side of things for the dermatology. So everybody is different, but absolutely it's a bit tricky with COVID, but it's organized. It's all good to go. When you're ready, we're ready, so nothing to worry about. But we are looking for the practical sessions, probably December or early January for the practical sessions.
Okay, and start date is 16th of November.
Yeah.
Is this to start with theory first?
Absolutely. So you need to develop your theory first, okay? And then alongside that, we take it from there. I'm going to take this last question because we're well over time now. So last question, please. And otherwise, get in contact with contact@medland.co.uk. Get in contact there. My YouTube channel's there. Subscribe, like that as well. Love saying that. Love doing that. So we'll take this last question, please.
I think that pretty much covers most of the questions. Sorry if I missed it. Oh, there was one other question. If you don't have the finances, how do you go about setting up a clinic, or how do you go about doing this?
Okay, so you don't have the finances. I've got a smile on my face, but it's fine. You don't have the finances. You want to set up a clinic. Well, I've always said that you don't have to set up a clinic. No one is saying that you have to go buy a premises. No one is saying that you have to go get a lease. In actual fact, it's a bit tricky now. Pharmacists, contractors, myself, we've got consultation rooms. Approach them, work with them. I've already had contractors approach me saying, when your students are ready, give them a place, please. We want to offer them a place, because everyone knows it's the future. There's a huge market out there. Just try it one day. Go to your local chemist and say, you want to set this up? Are you interested? The market's there. You can learn, practice, and then do your thing. After that, do your thing. But you can mitigate your risk. But as we took on the whole premises. So thank you very much. That was the last question. You can sign up by visiting medland.co.uk under aesthetics. I look forward to working with you folks. I hope you have a wonderful, wonderful, wonderful evening. Thank you very much for your time. God bless you all and have a wonderful, wonderful evening.
Could I just go?
We got a question.
Overseas pharmacists, do you help provide the course for them as well?
So overseas pharmacists, yes, we can. It's a conversation that we're going to have because if you're not regulated by the GPAC, things become a tad difficult. But again, as a beautician, you're able to do it as well, so it can be done. But that's a conversation that we need to have.
Okay.
Thank you very much, folks. Take care and look after yourself. And thank you for joining. Thank you.
All right, guys. I hope that was informative and you got something from that. Again, from this live session today on LinkedIn, it was again to kind of show you what the opportunities can be. In this case, we particularly picked community pharmacy because that's the background we come from, and just to show you, what potentially you can do or you can't do in any sector. So again, the topic today was in regards to aesthetics and community pharmacy, but the problems we have identified in terms of running a business are real for whatever business you're in, whether it's retail, whether it's, whether you're doing food, whether you're doing just like, for example, the job reports and the job losses from Costa and manager. So the whole point of today was to show you how learning and development, which doesn't matter which profession you come from, will be absolutely essential. Whether you decide to learn coding or whether you decide to upgrade and upskill with your practice, this is an example of one particular setting where upskilling can have certain advantages. So, and I would say to all those people who are looking at this September and October month, it's going to get uncomfortable. I know that for a lot of people. But there is one particular solution, which is upskilling. And the advantage is, you have so much information out there. There's no reason why you can't learn new skills and prepare for a future which is going to be very different to what we've had in the last year. But bear in mind that this was going to happen anyway. All COVID has done is just quicken the process. So keep learning, keep collaborating, and again, I'll push that word where speak to your peers. Don't think you're alone. contact somebody who's within your profession or within your industry or in another industry that you're thinking of getting involved with, and hopefully you'll meet like-minded individuals. And when you do that, there's an opportunity there to mitigate financial risks, or even get this financial support, get the mentoring, and really grow from there. So I'll be doing a lot of sessions over the coming weeks and months, specifically on networking, collaborating, and upskilling, because I think it's going to be the most important thing any of us do, no matter what business we're in. Have a good night, and thank you for watching. Take care. Bye.